Hi, I'm Nicole from 92.5 XTU,
And I'm Marisa Magnatta from 93.3 WMMR, The Preston and Steve Show.
and we're so excited to welcome the one and only Dr. Hwang to talk about hearts, which is so important, right? Like we
Couldn't do anything without it.
Yeah, I'm
literally.
definitely more of a heart person than a head person anyway, but we're here to talk about actually healthy hearts. And so we can't thank you enough, Dr. Hwang, for being here to talk about this. So welcome.
Thank you for having me. Thank you for having me here.
So let's just get right into it. What is a heart attack? Obviously, it's really kind of perfect that we're talking about this. The whole country was kind of stopped in its tracks with Damar Hamlin from the Buffalo Bills. And we heard a lot about a heart attack or a cardiac arrest. So could you just talk a little bit about what exactly that is?
Well, a heart attack is a process where part of the blood vessels that supply blood to the heart gets blocked. So you remember, your heart is a muscle, and its job is to pump blood. So like all muscles, the heart itself needs blood to work, and that blood, comes from coronary arteries, which are arteries on the surface of the heart. And when that blood vessel gets blocked for whatever reason, part of the heart muscle gets injured and actually dies. And that's what a heart attack is. And that process can be very quick, actually, because sometimes what can happen is that you have a plaque that was there that, for whatever reason, suddenly tears or ruptures, and it causes a blood clot to actually start forming pretty quickly inside the blood vessel of the heart. And that can cause a blockage very, very fast and quite unpredictably, actually.
So what you're saying is there might be something that has led up to this, but the heart attack itself happens very quickly.
Exactly. So what can sometimes happen is that you could have, a cholesterol plaque that's been there for many, many years, and one day, for whatever reason, it decides to tear, it decides to get injured, and you get a little injury inside the blood vessel. Now, remember, these blood vessels of the heart are very, very small. They're, an eighth of an inch, a quarter of an inch, and if you get a blood clot that forms in there with the body trying to repair the tear, that blood clot can then cause a sudden heart attack that can be quite catastrophic.
So we're going to talk about diagnosed and treatments, but I think it's important. And obviously you are the heart doctor, but there's a difference between a heart attack and cardiac arrest, if I'm not mistaken. So somebody explained it to me as a heart attack, you have to think of plumbing, where it's like the pipes get clogged and it affects your heart, where a cardiac arrest is like an electrical outlet. Is that a way to describe it?
That's one way to think about it. A heart attack is
Layman radio terms, doc.
That's very good. So a heart attack, as you said, is it's where the plumbing gets clogged and causes an injury to the heart muscle. Cardiac arrest is basically a condition where the heart stops. And it could stop for a variety of reasons. And a heart attack can cause cardiac arrest, but other things can cause cardiac arrest as well. Electrical short circuits of the heart, other conditions can cause the heart to stop. And so, they're somewhat different, although it is true that really bad heart attacks can cause the heart to stop. So one can lead to the other. If you do develop cardiac arrest, that's a pretty bad sign. You want to try to avoid that as much as you possibly can.
See, this is why I love people who are smart, because I think a lot of people don't realize that. So these are why these videos are so helpful, that we get to talk to experts. We're so blessed that Virtua allows us to talk to you, and we're so thankful that you take our time. So
thank you for having me.
Let's talk about the signs and symptoms of a heart attack.
Well, I always think about like everything I've learned from a movie, right? You grab your arm, you bang your chest, whatever it is. Are any of those accurate at all?
So I think that there's some truth to what you see in the movies. I mean, most people do get the classic, chest pain, clutching, heaviness in the chest, squeezing, pressure is what people, tend to describe. But you got to be careful. The heart does not have regular pain fibers. And so a lot of patients, women especially, and diabetics especially, don't necessarily get the classic pressure, pain sensation in the chest. Sometimes what they get is they get arm discomfort, neck pain, jaw pain, nausea, pain right around the belly. It's actually relatively common. for women and diabetics. So that's why it's very difficult, to sometimes identify, even for doctors, whether a patient coming in is actually having a heart attack or not. And so symptoms are there. Again, most people do get the classic chest pain that goes up the arm, goes up the neck, but not always. And you have to keep your suspicion up, for some of these patients.
Now, I've done some work with the American Heart Association, and everything you said just hit me, sorry, right in the heart, no pun intended. But a lot of women, especially, we tend to just brush off pains. We think it's a little something, a little nothing, it'll go away. I
Right.
don't worry about it. And that's not true. You really do need to check it out. But when do you need to go check it out?
So you check. So the if you're concerned that you could be having a heart attack, or that you're concerned, you should check it out. The thing about the heart attacks is that it's very important to get to the hospital very quickly, because the longer the blood vessel gets blocked, the more damage there could be. And when we get there early, we can save a lot of the heart. But if you get there late, that's when there's very little that can be done. And so, the message is you get there as soon as you're concerned. And here's also what I tell all my patients. If you're suspecting you're having a heart attack, do not drive yourself to the hospital, because God forbid you should get cardiac arrest while you're in the car, right? And that will not be good. You don't even want really your friends or family to drive you. Call the ambulance, call 911. That's what it's designed for. And they have medications. They can administer treatment right at your house. And so that's important. So the two important things are, number one, recognize the symptoms. If there's any concern, call early. Don't call late. Call early, and call the ambulance, because they are able to treat you right away, and that may save your life.
How are heart attacks actually treated?
So there are several ways of treating it. Major heart attacks, a complete blockage is treated by folks like me, where we, take you up to what's the cardiac catheterization lab, and we thread a wire into the blood vessel to kind of, get a balloon in there to essentially open up the blood vessel, and a stent to fix the blood vessel. Those are major heart attacks that are treated like that. You want to be able to get that done as soon as possible. More minor heart attacks can be treated with medication. So these are usually blood thinners, medicines that thin the blood. And again, because most heart attacks are caused by blood clots. So it all depends on the size of the heart attack and how the patient comes in.
And does the patient bounce back? I mean, are you right back into normal life after healing after a heart attack?
Well, if you come in early and we can get to your heart early enough, oftentimes the patients recover very, very well. And again, how fast folks bounce back depends on the size of the heart attack. If it's a small heart attack, if you come in early, if it's a small heart attack, folks can bounce back very, very quickly. And I've had folks who, are in the hospital for a couple of days, they go home and they feel completely fine afterwards, right? But on the other hand, there are big heart attacks, and these folks can spend some time in the hospital and develop, weakened heart muscle, afterwards. So again, it all depends on the size of the heart attack, and that to some extent depends on how fast you can get to the hospital. And so again, that's why the key message is to just be suspicious. If you got the risk factors for it and you're having discomfort that you think might be a heart attack, call early, and so that we can get to you fast.
That's why the term time is muscle is really important, right? Because the faster you treat it, the better recovery you would have.
Exactly. Yeah. So time is muscle. For the heart, time is definitely muscle. And you're right. The faster we can get to it, the easier the hospital course, the easier the procedure, and the better the recovery.
And do you want to explain just really quick to some people who aren't aware of what a stent is? Again, in layman's term, it basically opens up the passageway. But if somebody isn't familiar with that, they're like, Nicole and Marisa, you're not heart doctors.
So
I feel like it's important for people might not know what that is.
Yeah, so a stent is basically a tiny little mesh. It's a cylindrical mesh. It kind of looks like a little spring that fits inside the blood vessel wall. So remember when I said earlier that a heart attack oftentimes is caused by a tiny little tear that forms inside the blood vessel wall called a plaque rupture. It's when the plaque there kind of breaks apart. And so when the blood clot forms, we have a balloon in there that kind of clears the blood clot, but what's left behind is still that little tear, that little rupture. And so the stent essentially is a metal, device that essentially packs up the tear against the wall so that it doesn't cause any further problems.
I mean,
It's very, very small. It's, these stents are, 3 millimeters in diameter, very, very small, so that it fits inside the blood vessel.
It's just, science is phenomenal. And the fine motor skills you have to have, doctor, to put in.
Well, we go to school for quite a while. So,
yeah, you're like, trust me, it's a long time.
Yeah.
We both have older parents and we're around a lot of people. How do we notice signs of somebody else having a heart attack? I mean, again, going back to movies, where's all my information comes from, how do I know the difference between somebody experiencing indigestion or a real chest problem?
Well, the honest answer is sometimes you don't know. And again, that's why it makes cardiology so difficult or so interesting. But again, if they are complaining, I will say most people will have chest pain. So if they are complaining of chest discomfort right in the middle of chest, if they have if they're saying, oh, it feels really, really heavy, it's going up the arm, if they get all sweaty, if they're short of breath, if they're nauseated for unclear reasons that they shouldn't be nauseated, but now they are. These are all signs, and oftentimes they'll kind of tell you. Again, keep your index of suspicion there, and you want to make sure that, again, the idea is that you want to make sure you get there, you get to the hospital early.
Yeah, and I want to reiterate what you were saying about calling an ambulance. Like, I never realized when the paramedics arrive, they have medicines that can elongate and help.
Yeah, they not only have medicines that can help right away, but if you were to experience, if your heart were to stop, if you were to experience cardiac arrest, they can restart it right away. And on top of that, they can also alert the hospital and interventional cardiologists and the cath lab team ahead of time so that we actually get a head start to come into the hospital. Let's say if this were in the middle of the night.
Oh, you're not just waiting by the door for every patient to come in.
Well, sometimes we are, but sometimes we're not the whole team is at the hospital, and so we get a head start, coming in. But the key is that the ambulance, they're very, very skilled, they're very, very good, and they're good at recognizing heart attacks, and they have treatments that can be done right away if you need it.
Yeah. I mean, being a cardiologist, wow. I mean, what a amazing job.
Well, you do get a rush of adrenaline, and we are all adrenaline junkies here. But it truly is. It's a privilege, really, to be able to take care of these patients. And as cardiologists, we have the luxury of having one of the few jobs where we can see almost an immediate, instant gratification. Patients coming in really, really sick. You open up the blood vessel, and they feel like they want to go home. And so it's truly gratifying sometimes what you can see. But again, the key is to get there early. That's if that's the main message. If there's any message I want to get across here is to recognize the signs and get there early.
Yes,
we're gonna put the word on early just there later on. Sorry to the video team.
Of course.
So thank you again so much. And if there's could people come to see you even if they didn't have a heart attack? Like if people have heart disease in their family or they have a high risk factor, I'm assuming they can make an appointment. Well, they probably have to go to their primary and then they could say, hey, we saw this awesome video with Dr. Hwang and Virtua. We want to see him.
Well, Virtua has excellent cardiologists, and we are always happy to see folks, and we're always here. And so please, if you want to see us, I think it's fairly easy to make an appointment. I do think sometimes you have to go through your primary care doctor, but we have a team of wonderful, great cardiologists, and we're happy to see you. Typically, cardiology is a field where there are many different subspecialties, and typically you would start with a general office-based cardiologist before you see necessarily one of the subspecialists, like me. But it's a big organization with lots of wonderful, experienced cardiologists.
Well, they are, and they make it easy for everybody out there. In fact, you can go to go.virtua.org/heart consult, and you can see everything that Dr. Hwang was talking to us about today.
Thank you so much.
Thank you. Appreciate you having me here. Thank you.
Everything that you and your team does.
I know, it's
every
amazing.
single day. It's amazing.
Thank you.